Welcome to Diabetes Primetime, everyone. Tonight we are talking about probably the most important thing to know about type 2 diabetes, and that's heart health. Our guest is endocrinologist Dr. Enrique Caballero, and he's going to be telling us what every person with type 2 diabetes should know about taking care of our hearts. Before we get started, though, tell me where you're watching from tonight and what's on your mind. I'm so glad you've tuned in. Dr. Caballero, thanks so much for joining us.
Oh, thank you, Ansley. Thank you for having me with you.
So let's start off by talking about why our topic tonight is such an important one. Why does heart health matter so much for people with diabetes?
To start, I would say that cardiovascular disease is the number one cause of death in the general population, and it is also the most important cause of death in the population with diabetes. And in fact, we know that people with diabetes are twice as likely to develop cardiovascular disease as those without diabetes, even if their diabetes is well controlled. And that is because there's usually other factors that may be present in the person with diabetes. So it is the most important complication, so to speak, that everybody with diabetes needs to be aware of. In the end, 75% of all people with diabetes will, unfortunately, develop a cardiovascular problem.
So many more questions for you, Dr. Caballero, but before we get too far along, folks, I want to do our trivia question. We are doing a super cool giveaway tonight. It is a delicious guide to chocolate, just in time for Valentine's Day, listing all of chocolate's health benefits, as well as some delicious recipes that will help you enjoy chocolate in moderation, of course. And you will get that guide for free if you answer tonight's trivia question, which is, which country consumes the most chocolate per capita? Is it A, the United States, B, Switzerland, or C, Canada? Just a reminder, you don't have to get it right to get that giveaway. Just put your best guess in the comments and you will get those delicious recipes. And trivia tonight is brought to you by Arcray. As your diabetes health ally, Arcray helps make diabetes management easy and affordable. Visit arcrayusa.com/cost to receive a free blood glucose monitor, along with wellness materials to help simplify your diabetes management. Okay, Dr. Caballero, we've talked about people with diabetes being more at risk for heart-related problems. Let's talk about what we can do about it. What are some of the things that people with diabetes can do to lower that risk?
I would like, Ansley, everybody to remember the 5 enemies to the heart. Those are uncontrolled diabetes, high blood pressure, high cholesterol, overweight and obesity, and smoking. So those are the 5 things that people need to control very well. Now, in order to control all these different factors, there's 2 key things: a good meal plan and regular physical activity. I mean, something that everybody knows for sure, but it's difficult to implement that. But all these changes in meal plan and physical activity can improve diabetes control. They can improve blood pressure control, cholesterol, and certainly the weight. And then if someone has a healthy lifestyle, then smoking is probably something that is easier to push away. So those are the 5 things that need to be controlled. Now, of course, some people may need medications as well in order to control all these different factors.
So it sounds like a lot of the things we do to kind of live a healthy life with diabetes are also things we do to take good care of our heart. So I hear you say, eat a healthy meal plan, get plenty of exercise, definitely stop smoking. Are there any foods that people with diabetes should specifically avoid if they've been told they have, high cholesterol or high blood pressure?
Yeah, as you well know, Ansley, there's been always a quest for what a good meal plan is. And the first thing that I would like to share with everybody is I don't use the word diet anymore. I refer to a meal plan, a healthy meal plan. And the reason is that a diet in everyone's mind is something temporary, is something that people do for only a few days or weeks. And then they think that they can go back to what they were doing before. That is not going to work. That's not what is necessary for someone's diabetes to get better or for someone to get to the ideal body weight or control the blood pressure or cholesterol. I would like people to think more about the long term. What are those changes that people can establish, not for a week or 2 weeks, but for a long time? And that's obviously difficult. That's why there's been a lot of controversies. Well, what's the best diet out there? Is it low carbs, low fat, and so many different types? Well, if you look at the short term, of course, there's some that could be more impactful than others in helping people lose weight, etc. I truly don't really care much about those. What I want is people to look at what is going to help in 3 months, 6 months, a year, several years. And that's why I think that people need to pay attention more to the quality of the foods and also, of course, the amount. But in terms of the quality, most of the research that we have now suggests that there are very clear things that we need to choose. For example, vegetables, fruits, legumes, nuts, all those are very important. And meals that are not processed. We need to also look at plant-based proteins, for example, or if the protein comes from meat, it is better if it's lean meat or skinless poultry. Fish, for example, is great. Yogurt is actually very good. So people can mix all these different types of meals and create something that is attractive, something that they can sustain over time so that it's not boring. It needs to be obviously something that people enjoy. And there's things that we have learned that people should avoid. For example, processed foods, ultra-processed meals, all those things that are fried, that have saturated fats, all those things, please don't have them as, probably ever or as minimal as possible, because those are the things that can clearly impact vascular function, can impact diabetes, blood pressure, etc.
I'm so glad you talked about really thinking about your own preferences and what you feel like you can commit to for the long term, because we can do a lot of really restrictive things for a couple of weeks or even a month, but if we're not going to be able to stick to those changes over time, we're really not doing ourselves any good. Dr. Caballero, you mentioned exercise earlier as being very important for heart health. Are there specific types of exercise that we should be prioritizing to kind of benefit for our heart, or is basically anything good?
Well, I think that's been another important question in the field. And there was a time, Ansley, and I guess everybody probably remembers that we used to say only aerobic exercise is good. Go out and run and, increase your heart rate. Of course, that's an important type of exercise, but that's not the only type of exercise that is recommended. Now we talk about 3 types of exercise. One is that, which is the aerobic or cardiovascular exercise, but there's also strength exercises. So if you like to do weights, if you want to lift, some objects, etc., that could help you strengthen your muscles, and that could be very good. And the last type is stretching exercises, flexibility. All those are going to be very important for muscles and for joints, etc. And interestingly, there's data that show that all these types of exercise can help in improving blood sugar control. It could also help in cardiovascular health, etc. So what we now recommend is a combination of all these exercises. And the rule that everybody needs to remember is 150 minutes of exercise per week, minimum. Now, if you divide those 150 minutes into, let's say, 5 days of the week, that means 30 minutes at least 5 days of the week to exercise. And the good thing is that you could actually, for example, split those 30 minutes and do 10 minutes in the morning, 10 in the afternoon, 10 at night, or 15 in the morning, 15 at night. The body is so generous and it's so wonderful that anything that you could do is going to help. Now, take it easy. You need to talk to your doctor, of course, because not everybody can start from zero and then maximize the amount of exercise because of heart issues, etc. But a gradual increase of exercise, starting with moderation, I think that is always very important. And exercise has other benefits. Bones, our mind, people feel much better. There's all that energy and all those hormones that are produced that make us all feel great. So exercise, Ansley, should be just part of our daily life. That's very important.
Folks, if you're enjoying tonight's show and the awesome information that Dr. Caballero is providing, check out our podcast. We do interviews with diabetes experts on a whole range of topics, everything from exercising safely to preventing complications. Just search Diabetes What to Know wherever you listen to podcasts and subscribe. Okay, so we've talked about diet and exercise. Let's talk about that third very important element of diabetes management, which is medications. So if a person with diabetes has been diagnosed with heart issues, are there specific diabetes medications that they should ask their doctor about?
Yes, I think that people need to be aware that there are multiple medications to control diabetes. There was a time when we were looking at medications only based on their ability to lower blood sugars. We're beyond that part. All of them work in reducing blood sugars. Now we look at what do these medications do to the heart, for example? What do they do to the weight? What do they do to the blood pressure? What do they do to cholesterol, et cetera, et cetera? And there are some that I think everybody needs to be aware of. One is metformin, that has been around for many years. And if for people with diabetes, type 2 diabetes in the audience, I'm sure that they will raise their hand and say, I'm taking it. And it is very likely. Why? Because it's the oldest medication that we have used for diabetes, or one of the two oldest. And it's very safe. It's very cheap. We have more than 50 years of experience with metformin, and it is always the first line therapy in most treatment guidelines for type 2 diabetes. There's two new classes of medications. One, and I know that the names are quite complicated, but one is GLP-1 receptor agonist, and the other one is SGLT2 inhibitors. I don't think that we need to go into the details about what all these do or mean, but one is, the first class is an injectable medication, although there's a new oral medication in this class. And GLP-1 receptor agonists can help in controlling blood sugars. They can also help in lowering weight. They may also have an impact in blood pressure. And SGLT2 inhibitors are oral medications, so they are taken by mouth, and they do very similar things. They lower the weight, they lower blood pressure, and obviously they control blood sugar as well. But the nice thing about these two classes of medications is that in some of the recent studies, both have shown the possibility of reducing the risk of cardiovascular problems, exactly what we're talking about. So it's important for everybody to discuss the pros and cons of all these medications with physicians, with healthcare providers, to better understand, because we cannot say that everybody should be on the same medication. There's different classes. There's different reasons why people should be or should not be on these medications. But I think that you should be aware of these new classes of medications. Talk to your doctor and try to come up with an understanding about what's the best medication for you.
So definitely people want to talk to their doctor always about what medication would be right for them. But I guess my follow-up question on that is, can those medications help someone with diabetes who maybe hasn't been diagnosed with heart issues but wants to prevent future problems? Have those medications shown to prevent problems in the future?
Yeah, the studies show that primarily they help those individuals who have already developed a cardiovascular problem, let's say a heart attack or a stroke, for example. But also some of these studies have shown that even in people without established cardiovascular disease, there could be some beneficial effects. And I think that's really great, because some of these medications can help reduce the risk of cardiovascular problems.
For those of you who are just joining us, we're here with endocrinologist Dr. Enrique Caballero, talking about how to take good care of our hearts. And we are giving away an awesome guide to chocolate. It lists all of the health benefits of chocolate and has some delicious recipes too. If you love chocolate as much as I do, you will definitely want to check this one out. All you have to do is answer tonight's trivia question, which is, which country consumes the most chocolate per capita? Is it A, the US, B, Switzerland, or C, Canada? Put your best guess in the comments to get those recipes. Dr. Caballero, we've talked about prevention, but we should also talk about how someone would know that heart issues are something that they need to be concerned about. What are the heart disease warning signs that people with diabetes should be on the lookout for?
Yes, that's very important, Ansley. And I would say that let's separate signs that could suggest that people may have a stroke and those that may suggest that people are having a heart attack. So when we talk about a stroke, we're talking about that complication when the circulation to the brain is interrupted. And that obviously could be a very devastating condition, sometimes even fatal. So what are the signs? And I think people will like this. Remember the acronym FAST, F-A-S-T. F is for face drooping. That means that probably one side of the face is getting a little bit weaker. So you will see, for example, that the eyebrow or the corner of the mouth droops. So that would be one sign. Then A is for arm weakness. If someone notices that the arm is not moving well or has difficulty moving the arm, is getting weak, that could be a sign of a stroke. S, speech. If someone has difficulty with his or her speech, slurred speech, that's something that people would immediately recognize. That's another very important sign. And the T, very easy, time to call 911. You need to go to the hospital because that could be a serious condition. And one important thing to remember is that the sooner someone gets to the hospital, the sooner they can get treatment to reduce the potential complications of a stroke. Now, on the other hand, when we talk about a heart attack, for example, then people need to remember that the typical symptom is, of course, when someone has chest pain, and that's usually at the center of the chest that is described as pressure or discomfort, something that people just feel heavy perhaps. So that's the typical one, and it's one that may last for minutes. It's not something that is just for 1 or 2 seconds. It could last for several minutes. Sometimes it may go away and come back. So people need to be paying attention to that. There's also other things. For example, it's not always the pain in the chest. It could actually be in one or both arms. It could be at the level of the neck. It could be at the level of the jaw, for example. It could actually be in the back or sometimes at the level of the stomach. So pay attention to those things. And of course, I don't want you to feel obviously concerned every time that something, bothers you, that you're having a heart attack. No, but just keep in mind that everybody's different and the way the symptoms manifest may differ from individuals to individuals. If you are in having any of these issues at any point and you're concerned, call 911, go to the hospital, because it's the same principle. Now we have very effective therapies that require to be administered immediately, very soon after someone has either a stroke or in the process of having a heart attack, and that could make a huge difference.
So let's talk about blood pressure and LDL cholesterol a little bit. We know they are such important heart health markers for people with diabetes. Should every person with diabetes who has high blood pressure be checking their blood pressure at home?
Controlling blood pressure is something that in many different studies has shown a very important impact in reducing the risk for complications, not just cardiovascular disease, but even, for example, eye disease, chronic kidney disease, peripheral vascular disease. So controlling blood pressure is absolutely critical in individuals with diabetes, as it is obviously in the general population. We're recommending to most patients with hypertension, with high blood pressure, to check their blood pressure at home. There's monitors. They're not perfect, I have to say, but they give a good idea of about the blood pressure. So that, in combination with what is obtained in the clinic, can give us as healthcare providers a better idea of what the blood pressure is, how it is running, and what adjustments we need to make either to lifestyle or to the medications.
So talk about LDL cholesterol a little bit. What should a person with diabetes be shooting for? And what should people be aware of about cholesterol?
Yeah, cholesterol is basically one of the biggest enemies for the heart. Cholesterol will directly get deposited in the vessels, in the arteries, and eventually block the circulation. In people with diabetes, we know that can actually happen more quickly. So controlling cholesterol is important for everybody, but in people with diabetes is even more important. Now, there was a time when we were looking only at numbers, Ansley, and we were saying, okay, less than 100 milligrams per deciliter is the goal. Oh, no, let's now go to less than 70 milligrams per deciliter. There's now so many studies that show that the lower the better, but it is important for everybody to consider, and these are the new guidelines, that reducing cholesterol, regardless of where people start, will decrease the risk of a cardiovascular problem. So someone may have, let's say, an LDL cholesterol of, let's say, 98, which is under the 100 mark that we used to talk about before. Well, there are studies that show that if that person goes from 98 to, let's say, 70 or 60, even though that LDL was not that bad, may actually get a benefit and reduce the risk for cardiovascular problems. That is why now in the guidelines, and this is very important for everybody in the audience, the current recommendation is for everybody with diabetes to be on a medication to lower blood cholesterol that is called statin. Statins are medications that are very effective in reducing cholesterol levels. Talk to your doctor, because most likely your doctor is going to recommend that you take a medication to lower your cholesterol, and that's okay. This is one of the most effective interventions that we have in the medical field to reduce the risk of strokes and cardiovascular disease, even peripheral vascular disease. That's one of the most important recommendations, along, of course, always, Ansley, with a better lifestyle in terms of better meal plan, reducing, obviously, the foods that have cholesterol. Although sometimes people forget that in the end, what we eat is only going to contribute to our cholesterol levels by no more than probably 15 or 20%. Most of the cholesterol is what we produce in our bodies. That's why reducing the production of cholesterol with statins is so important in people with diabetes.
So what I hear you saying is not even a question of if I'm going to be put on a statin, but probably what type of statin. It's that beneficial for people with diabetes to be on a statin that can help lower their cholesterol because, as you say, what we eat only contributes so much. All right, last question for you. We hear a lot about the benefits of weight loss for diabetes, but can losing a little bit of weight help someone lower their risk of heart problems as well?
Absolutely. Weight loss, lifestyle modification can prevent many problems, not only diabetes, but all the complications that are related to diabetes. So it's something that we all should do. And I would say, actually, not even to wait until someone develops diabetes. We all should do it. If people have pre-diabetes, the general population, a good meal plan, exercise is really something that we all should really be doing all the time.
Wow, what a great way to end our interview. I'm inspired. Thank you so much for sharing such great information with us tonight. We so appreciate your perspective.
My pleasure, Andy. Thank you for having me, and my best luck and best wishes to everyone.
Before we go, folks, here is the answer to tonight's trivia question. Which country consumes the most chocolate per capita? The US, Switzerland, or Canada? The answer is B, Switzerland. And if you haven't answered that trivia question yet, just tell us what you thought of tonight's show, something that you learned, and you will get that awesome guide to enjoying chocolate with recipes. I'll be back with you next time on Tuesday, March 9th at 8:30 p.m. Eastern Time. I hope you're able to join us. Until then, stay safe, stay healthy, and take good care. Good night.